Like any other woman, Justin Nakato was excited when she delivered her firstborn child in January last year. Nakato's joy was abruptly turned into sorrow when the child turned out to have 2 reproductive organs.
Mama yali anazo mwana naye nga mudole batugamba tuzadde mwana muwala naye nga bw'omutunuulira bw'oti akeekiwala tekalabika kabalenzi waggulu ke kalabika kana akabawala kali wansi era omalamu bikula bw'oti wansi.
The baby, now 1 year and 2 months old, has a penis but with no visible scrotum. He also has a vagina, one that looks well developed. This condition of ambiguity shocked his parents. The couple spent the past year seeking medical help for their child. They have since run a number of tests at Mulago Hospital. However, Nakato says their efforts to get medical attention beyond the tests are futile.
Twagenda ne Timothy Mulago nga wa wiiki egi emu mpaka weyaweza emyezi 6 mu mwezi gw'omusanvu naye nga tewali kintu kyonna.
Months after failing to secure medical help, the parents agreed to call the baby Timothy Ziwa.
Kubanga batugamba nti talina nnabaana kati ne tulowooza omuntu aba talina nnabaana automatically ateeka kuba mulenzi.
Baby Ziwa's condition is one in a range of conditions described as intersex. People born with characteristics that don't fit typical description of either male or female. The World Health Organization estimates that between 0.05% and 1.7% of the population is born with intersex traits. Dr. Tamale Saleh, an obstetrician gynecologist at Women's Hospital International and Fertility Center, explains this congenital anomaly.
When the mother is pregnant, 10 weeks, which means 2 months, that's the time when the genitals start developing. Anything that might have interfered previously with those cells to start moving, to start making the, for example, the uterus or the penis or the testis, anything that may interfere with that process may lead up to a product which is not complete.
The causes are not known, but a number of factors have been found in some to interfere with the development process. These include medications like cancer medication and ARVs that are known to kill cells, X-rays, and exposure to explosions like people working in mines, among others. There are 3 types of intersex people: true intersex, male pseudo, and female pseudo. For true intersex, the reproductive organs can vary from completely male or female or a combination of both or even ambiguous looking.
For a woman, we have the XX chromosome, and then for the men, they have the XY chromosome. And it's the Y chromosome that has the strength to determine whether this person is going to be a girl or a boy.
Female pseudo means that a person has female chromosomes with normal female internal organs, but with male-looking reproductive organs. While male pseudo means that the person is born with male chromosomes, has tests which are usually hidden in the abdominal cavity, with usually external female sex organs.
When the child is still in the mother's uterus, 8 weeks, 2 months, so the testes they start descending, migrating to their final destination, the scrotum. The scrotum is the bag which holds the testes. But they are stuck here. This is a very easy surgery to do. We can do open surgery and remove these testes, because if you leave them there, by the time this person becomes around the age of 40, 10% of this, they will become cancerous.
Dr. Sabrina Chitaka, a pediatric and adolescent medicine lecturer at Makerere University School of Public Health, says the first thing is to determine the true sex of the child.
Confirm, are they a boy or a girl? And that can be done in a pathology lab. We determine which sex hormone this girl or boy has. And then we look at the internal organs and then the external genitalia.
Once the doctors establish the right sex of the child, a surgery is performed on the outside sex organs to make it physically look either male or female.
If you find that this person is phenotypically a woman, then you want to promote the female part of the baby.
The non-surgical strategy, on the other hand, takes the form of a child genetic test to determine the sex that they are comfortable in.
Because we've had cases where someone is supposed, after these tests have been done, chromosomal, hormonal, blood tests, and they prove that the sex that was assigned at birth wasn't the right sex. For instance, I was raised as a boy, but at puberty, after I've had all these tests, it's discovered that I'm not a boy.
This sexual assignment, medics advise, should be done early enough before the age of 4. Dr. Sally says many of these conditions are not life-threatening.
Some of them are associated with life-threatening condition. For example, there's the condition where the child has got all these male characteristics but is losing salt electrolyte imbalance.
Intersex children and adults are often surrounded by stigma. Many grow up silently with the conditions, fearing to seek medical attention. Tom Makumbi, the project's coordinator at Support Initiative for People with Congenital Disorders, an organization that supports and advocates for the rights of intersex people, says they have registered over 1,500 people since their inception in 2008, a small number compared to those who are undocumented.
Close to 50% of the children are born in the hands of the traditional birth attendants, who may not even have chance to see, a medical care practitioner working on them. And the other thing is, even in these hospitals, like we don't have like a central registry where these cases are recorded.
This lady, whose identity we shall conceal, has lived the 34 years of her life as an intersex.
I'm not like other girls. I have no vagina. I just have where I can urinate from. I have never gone in my period, and I have never developed breasts like other girls do.
Checkups earlier done on her revealed that her ideal sex is female, and so the doctors put her on hormonal treatment.
Medicine. I was supposed to be taking tablets every month for the rest of my life. Actually, I was supposed to be taking it for the rest of my life, but I couldn't manage the monthly cost because it was about $70 per month.
Sometimes all you need to do is support the production of the hormone and suppress the production of other hormones.
Doctors tell us that many of these intersex conditions are actually not life-threatening, which means that someone can live with this condition through their life without any harm. But there are also chances that someone can get surgery to rectify these. Unfortunately, this surgery is quite costly for many an average Ugandan.
If I could get a chance, I get a doctor who can do a surgery, I get money to go and do my surgery, I would prefer to have a surgery because I want to have a family.
This one, you need to go to people who are actually do vaginal reconstruction.
Good news is that the majority of diagnosis, management, treatment and surgeries of intersex people can be performed at local hospitals, except in complex cases.
Surgeries for those ones who are below 18 have been free. But because of our economy, things are now changing.
The greatest challenge for such people remains inadequate access to health care and living with stigma.
Here, I have to go to Egypt. That's why I can go and do a surgery. But I couldn't get the money.
Gertrude Tumusime with Kware, NTV.